Hi, I'm Dr. Brian Gray, and I'm the Chief Clinical Officer at Candid Pro Clear Aligner System. I'm here today to talk to you a little bit about the clinical philosophy that sets us apart and makes us such a special and unique part of orthodontics and dentistry. There's two things that really make us special and unique, and that is predictability and consistency. We achieve that through some really key metrics that make us different. One is that we've got an expert-led team of treatment planners that help to give us the best treatment plan possible. We use standardized orthodontic techniques to help accomplish those goals, and they're developed on protocols that we have ourselves developed over time. And we do this all by using the best ability to crunch data to give us those fine results. There are six key points that I'd like to cover as far as the clinical philosophy is concerned with Candid. One is that we use US-led orthodontists as clinical guides to help give us the best outcomes possible. The second is that we use data-driven treatment. I talked a little bit about that earlier, and we're going to cover it in depth in a little bit. And then the next is that we look at developing the full arch. The fourth one is that we want to create a better patient and practice experience through a number of things, in particular monitoring. The fifth is that we used advanced manufacturing, and we like to emphasize the key points that set us apart from some of the other manufacturers out there. And then finally, we want to talk about stability, including long-term retention. Let's start with point number one. US-led orthodontists help to give us the clinical guidance necessary for success with our treatment. They help oversee case selection for us by giving us an idea of the suitability of the case that doctors are looking at. They will help with the treatment planning aspect. After the treatment plan is developed by our treatment planning team, each and every case is reviewed by an orthodontist that will be able to give them input and advice on how to maximize the efficiency necessary for the best movements in the shortest amount of time. And finally, they provide an on-demand expert support mechanism for doctors and team members that run into trouble during treatment and are looking for some helpful solutions to be able to keep things moving on at a pace that's acceptable for the patient and the practice. These three things really make us unique, having these US-led orthodontists that are able to review and oversee every single case. Now, it helps to be fulfilled by having data-driven treatment. That second key point that we talked about is the North Star of what really sets us apart and makes us drive towards our goals. We look at pre-treatment, in-treatment, and post-treatment data that guide us on where we want to get as far as success is concerned. It is leveraged and developed off of each and every movement that is recorded via the monitoring systems that we use so that we're able to provide a better outcome with each and every case. We use previous cases to help give us the necessary information to make the future cases even better. That helps us to now provide support for predictable results for our patients and make things more acceptable for the doctors, knowing that they're going to get to that result that they really, really want. The remote monitoring is the key to the success for this. It's the only FDA-approved monitoring system in our profession for orthodontics that gives us the guidance necessary to make sure patients are ready to move on to the next step. It uses the AI-driven software to help tell us when things aren't fitting and how to get them back on track. Oftentimes, by just keeping the patient in the aligner a little bit extra time because the tooth hasn't fully expressed the necessary movements to make sure it is completely ready for the next aligner. Keeping them in that for a little bit of extra time sometimes means that maybe the patient hasn't been completely true as far as their compliance is concerned, and this is a great way to make sure that we keep them on track. We can send them messages. Obviously, we can have this be AI driven. Also, we can have both the treatment planning team and the orthodontists look at this inevitably, and ultimately the doctor is going to be the one who's going to help to manage that case. And it's made simple by having this hierarchy of protocols related to whether or not something is completely tracking. So it makes monitoring unique and best for us. And again, it's something that we are the only company that has available. I talked a little bit about developing the full arch, and I think that that's super important for us. Many, many programs look at a retractive and shrinking type of movement in order to accomplish their orthodontic goals. This, we know, now is really the opposite of what you want to do. You want to be able to develop the arch by moving teeth into the position where they really should be. It gives us better stability, and it's going to give us better long-term results with less chance of relapse. It's part of our, again, our overall long-term patient goals when we look at developing the arch and making sure we've got the teeth in the most ideal position. Part of our philosophy that is seen through from the very, very first time the case comes in and our treatment planners look at it, all the way through the final delivery of aligners and the finishing of treatment and into the retentive phase. That's what gives us a better patient and practice experience because it's seamless throughout. We've been able to incorporate the monitoring into the overall system. The only, again, company that's been able to do this makes it seamless, where before other companies would have to have you hire someone in your practice to help manage the monitoring. It's made so that you can do it without even thinking. It becomes an easy part of the workflow for you, and it gives us more of a less is more approach. There's less visits, there's less adjuncts, there's less attachments, there's less IPR, so that we end up with a superior result with the best efficiency that you could possibly imagine. That gives us wonderful success and makes the pain management part something that we don't even have to talk about. It's just an afterthought. We just don't have to worry about that because everything tracks just the way we want it to. The patient follows the rules. We're going to end up with a really, really great result. What helps to give us that great result? The manufacturing. So we've got really, really superior manufacturing via our carbon printers that we've talked about, our incredible trim line and the cut that's associated with it, and the material itself, a special type of plastic, trilaminar, that gives us the best possible movement possible to make sure that the teeth fully express and the plastic doesn't fatigue. Really, really great long-term memory to that plastic as well. Some great studies to show that. You've seen those. It's something that we should emphasize. That sets us apart over the other competitions that are out there. Lastly, the stability. The final part that I'd like to talk about is making sure that we've got this beautiful result staying that way long-term. And that's through a really great retention system that I personally helped develop. It's the second time I've gone through developing a retention system, and I'm really proud of this 2.0 version. I think this is super for our patients all around. We've got plastic that's got great rigidity and memory. They last about a year average a piece. You can order them in numbers of 1, 2, 3, or 4 at about half the price of the other competitors out there, and certainly a much superior product. That takes us through all the different things that set us apart as far as clinical philosophy is concerned and the key principles associated with it. Thanks for attending. Again, this is Internal Facing.